For most of this year, the pandemic has made inequalities more difficult to ignore that can involve differences of race and employment, but also age and sexual orientation. That shows up in a recent study of disparities among the state's older LGBTQ population, for which the research began last year. To tell us about the findings is the Director of Health Policy Research at the Fenway Institute, who's also a member of a special legislative commission on LGBT aging. We'd like to welcome Sean Cahill. Thank you very much for being with us, Sean.
Thank you, Chris.
Sean, I want to start off with a part of this that is, I think, maybe almost a seasonal cause for alarm, but different in this population as you study, and that is about the state of mental health. What did you find?
Yeah, so we have some qualitative data and some quantitative data in the study. The qualitative data is from listening sessions that we conducted around the Commonwealth, in Boston, in Salem, in Worcester, in the Berkshires, on Cape Cod, and then a number of virtual listening sessions that we did after the pandemic hit. And then we also looked at data from the State Behavioral Risk Factor Surveillance System survey. And what we found is that older LGBT people aged 50 to 75 have about twice the rate of report having a depression diagnosis at about twice the rate as the general population in that age group. And we also found that a lot of people in the listening sessions talked about the need for mental health services, for bereavement counseling. There were a lot of people who were widows or widowers and didn't feel welcome in some of the mainstream bereavement groups and really wanted bereavement groups for LGBT older adults and ongoing supports for bereavement. And a lot of people just talked about social isolation in general and wanting more social activities.
I know this might be more of a problem for people outside major cities, but as LGBTQ people get older, I guess what you have is people who find they have to sort of go back into the closet because of where they are. They might be in an institutional setting. What does that do to people?
Well, I think it exacerbates minority stress. We, throughout our life course, LGBT people tend to have higher rates of minority stress and social anxiety. And a lot of that's related to navigating disclosure and, concealment of our sexual orientation or gender identity or disclosure of that, and just kind of worrying about what other people think. And so what we heard, particularly from people living in rural areas of the Commonwealth, is that there's a high level of discrimination. They experience a lot of anti-gay, anti-lesbian, anti-transgender discrimination in their lives. So for example, we had one gentleman who I met at a congregate meal program in Salem who lives in rural Essex County, and he disclosed to someone in his senior living facility that he was gay. And the next thing you know, everyone in the building knew, and he started experiencing a lot of harassment from straight age peers. Mostly women, actually, because most of the people living in the building are women. Just people saying really insulting things to him. And then we had a couple of older lesbians from the Berkshires who talked about experiencing discrimination in a hospital, in a hardware store, in a bank. And the discrimination they experienced was actually deliberate misgendering of them and kind of harassment. So they're both women, they're cisgender women. In other words, they're not transgender, they're lesbians. And but the harassment they experienced was people were calling them sir and Mr. and things like that. And, they're women and they may not fit your stereotype of what a woman should look like or behave like, but they're women. And so they asked the people to refer to them as Ms. or, using female pronouns. And they kept doing it. So the woman who had the problem at the bank, she went back to the bank several times, and the bank tellers were referring to her as a man. And so she complained to the management, and the person who experienced that problem at the hospital did the same thing, but they didn't really get satisfaction from the management of those institutions.
I know in this report, you say quite a bit about the need for bereavement help for widows and widowers or people who've lost partners. But on the other hand, and I'm thinking, these are people who don't have kids to come and see them. But as your report points out, among the middle-aged and older people in the LGBTQ population, they're just as likely to have kids as anybody else.
Yeah, that was a really interesting finding. And we looked at some data a few years ago from the Massachusetts Behavioral Risk Factor Survey and found a similar finding. So LGBT older adults, 50 to 75, are raising children under 18 in their homes at about the same rate as straight cisgender people age 50 to 75. So they were slightly less likely to be raising children, but the difference was not statistically significant. And that was really striking. So yeah.
You would think it's good news, but on the other hand, what about those relationships with those relatives?
Well, a lot of people experience rejection from their families, definitely. And they talk about that. And I remember meeting a transgender woman who was rejected by her son, and she had a grandchild, and she had never met that grandchild because of rejection from her child. So that's definitely an issue. The other thing that we found is that the rate of serving in the military was about the same as well for LGBT older adults. And that's really interesting because there's a lot of anti-LGBT policies, military policies, that have been in place over the decades. And despite that, members of our community are serving in the military at about the same rate. So to our view, that really is evidence of resiliency on the part of LGBT older adults.
Yeah, I want to get to the part about resiliency because resiliency means two things, a good thing plus a bad thing. So how does that work in this population?
Right. Well, what we note in the report is that a lot of people in our community have experienced a lot of challenges related to, say, the HIV/AIDS epidemic, losing their partners, losing friendship networks to AIDS, particularly prior to the advent of antiretroviral medications in the mid-90s. But I think that evidence of resiliency is that we are here, particularly older adults are here. We are we've created a lot of good policies and a lot of good services in Massachusetts. So in many ways, Massachusetts is at the forefront. So particularly when you look at like LGBT older adults and policies, we're the only state in the country that has designated LGBT older adults as a population of greatest social need under the Older Americans Act. And that allows for targeted services for our population. We have more congregate meal programs for LGBT older adults and their friends than any state in the country. And that's because of advocacy on the part of LGBT older adults. And then another data point that I thought was evidence of resiliency is that we are more likely to go to college and graduate college than straight cisgender people in our age cohort. And I think that's evidence of resiliency because a lot of us experience challenges when we're, adolescents or young adults. I know a lot of people, they drop out of school, they run away from home, they drop out of college, but we end up graduating at actually a higher rate than the general population. So that's very interesting.
That's a plus. One of the minuses you have to contend with is that even despite that advantage of higher education, the LGBTQ population is less likely to be homeowner. So that means they pay rent, and eventually that creates a big problem.
Yeah, that was an interesting finding. So we're more likely to pay rent than own a home compared to our age peers who are straight and cisgender. We also were more likely to report having trouble paying rent or paying for food in the last month. That's another question on this survey. And I think the higher rate of rental could be related to the fact that we're more likely to live in urban areas. So like if we have a map in the report that shows where LGBT people live county by county in Massachusetts, and the county with the highest percentage of the population that's LGBT is Suffolk County, where Boston is. About 9.5% of the population is LGBT, of the adult population. So I think the high rate of rental is probably related to living in urban areas, but I think some of it is also that we are just not buying homes at the same rate as the general population. And then, in older adulthood, that can become a problem because we don't have that nest egg that other retired people rely upon, in retirement. And we're still throwing a lot of money out the door on rent.
You also looked at a racial divide within the LGBTQ population. How bad is that, and what should be done?
Yeah, so when we were doing the listening sessions, especially somewhere before this, but we had a lot of awareness of Black Lives Matter and policing issues and structural racism in our country, which goes much beyond criminal justice. It goes into home ownership and income and poverty levels and so on. The LGBT community is not immune to those broader dynamics that we have in American society of racial inequality and racial inequity. And so at the listening sessions, people raise concerns about going into predominantly white LGBT organizations and not experiencing affirming care or affirming services, or experiencing discrimination on the part of white LGBT people. So we highlighted that in the report, and we talked about that in addition to wanting to see changes in government policies and government-funded services, that a lot of us who work in organizations like the one I work at, Fenway Health, we want to try to do a better job of ensuring that we're serving everybody equally and that we're providing culturally competent, affirming care to people of color in the LGBT community.
I know we don't have time to cover much of it, but the report makes a lot of recommendations about access to care, things to overcome isolation, access to the internet. So if people want to see more about this, is there a place they can find it online?
Yeah, it's at fenwayhealth.org. The report is there. The report is called LGBT Aging 2025. And so it's a visioning report about what we want to change in elder services and elder policy to better serve the LGBT population. So if you Google LGBT Aging 2025 Fenway, you should be able to find the report.
Thank you very much again for taking the time to join us.
Thank you, Chris. Happy holidays.
Yes, same to you, Sean. That was Sean Cahill from the Fenway Institute. And we'll have more news in just a moment.